Brilliant, thank you. Hopefully you can all hear me okay. I can't actually see if there's any responses in the web chat or anything like that, but Alyssa has kindly said that she will help out with that. So that's brilliant. So just to introduce myself quickly before I go through the title and everything like that, my name is James Beasley. I'm a senior probation officer here in Wales, and I'm seconded to the Violence Prevention Unit. And this is? I'm
Alice. I'm also a probation officer in HMPPS in Wales, also seconded into the Violence Prevention Unit.
Okay, thank you. So here we're going to be talking a little bit today. Oh, first thing I should say, I think it's put down for an hour and 50 minutes. I'm sure you'll all be glad to know that this won't go on for that long. That was a bit of a mistake. I think it's around 30, 40 minutes, depending on questions and how much we get excited by the topic and talk more than we're supposed to. That's usually Alice on that one. She'll probably say it was me. So yeah, we're here to do a presentation on implementing a public health approach to serious violence within HMPPS. So HMPPS is Her Majesty's Prison and Probation Service here in the UK. Yeah, Alyssa, if you don't mind going on to the next one, please. Hopefully you can see this okay. First of all, on the right, we've got a lovely little map of Wales. Hopefully everybody knows where Wales is. And the reason I say that is because I'm Welsh and I'm very excited for our little country. But some people in the UK wouldn't be able to point it on a map. So we're a small country. I think it's about 4.5 million people. Our kind of major cities, if you want, are Cardiff, Swansea, which are down in the south part of the on the map. And then we have some towns and kind of, I suppose, smaller cities maybe in the north. And then generally in the middle, it's very rural and country, you know, very countryside, very cute. So Her Majesty's Prison and Probation Service in Wales, as we mentioned, the HMPPS is here to prevent victims by changing lives. So we kind of do that through rehabilitation of offending, and we're also identified as the kind of risk management professionals in the UK. So we manage risk. So it doesn't matter whether you've been given a community order. So that's, you know, you're subject to an SSO, what is an SSO? Suspended sentence order, a community order, or even if you've been given a custodial sentence, you'll still be managed by a probation officer. Now, in relation to grades of probation officers, we kind of have a probation officer and we have a probation service officer. PSOs will manage those medium and low risk offenders, and POs will manage high risk offenders, and that can be terrorist cases, murderers, rapists, drug dealers, you know, your kind of serious offences. We work with our partners to carry out the sentences given by the courts, as I said, either in the community or custody. And even while they're in custody, as a probation officer, we'll be the kind of one who's proposing what work they should complete while in custody. We reduce reoffending by rehabilitating the people in our care through education and employment. The agency is made up of prison service, probation service, and that kind of thing. What I would say is that where, you know, the probation service has evolved over time. Originally, it was set up purely around rehabilitation. Then we become more around risk management. And now we're kind of developing further to consider contextual safeguarding concerns, as well as adverse childhood experiences. So we kind of work with them around that. We're also just started doing some work in Wales around hidden harm. So this is the trauma that people can suffer as adults while involved in offending behaviours. So for instance, it can be PTSD from witnessing people being stabbed or being stabbed yourself, to the harm caused from spooning and other offences. If you're not sure what spooning is, that's where people who secrete drugs in their bottom can be assaulted and spoons used or other implements used to get those drugs out. So they can be, you know, it can be a very traumatic experience. So yeah, on to the next slide, please, Alyssa.
Okay, so we're going to do a little bit of an icebreaker. As James said, we can't actually see you guys or anything, so hopefully you're going to go along with this, and we'll explain why we do it afterwards. So if you can get a piece of paper or just use your phone or just count on your hands and give yourself 1 point if you've done any of the following things. So if you've ever driven over the speed limit in your country, If you've ever purchased alcohol under the age of 18.
Or 21, depending on
depends
the,
how you are.
yeah, depending on the legal age range.
If you've ever taken illegal drugs. If you've ever driven through a red light. If you've ever taken a child out of school during term time without permission. If you've ever not worn a seatbelt in a moving car. If you've ever claimed an item at a self-service checkout without paying for it. If you've ever streamed films and TV shows without paying for them. If you've ever sent a text message whilst driving. Or if you've ever thrown litter on the floor in a public place. And what we'd ask you to do is just kind of count them up. You can keep them to yourselves if you want, that's absolutely fine. If you're happy to share them in the group chat, just to kind of see what everyone's getting out of 10. I think when I did it, I got about 6.
She's lying. She got 9. She got 9.
So yeah, just have a kind of look at that and see. I'll give you a minute or so just to kind of think about that.
Yeah, we'll just go over them again. So driven over the speed limit. If you've done that, give yourself a point. Purchased alcohol under the legal age in your country. Taken illegal drugs, be that cannabis or anything harder. Driven through a red light. Taken a child out of school during term time without permission. Not worn a seatbelt in a moving car. Claimed an item at a self-service till without paying for it, or even if you put it through as a cheaper item. Streamed films and TV shows illegally without paying for them. Sent a text message whilst driving, and the absolutely worst of the lot, thrown litter on the floor in a public place.
And we can just see some numbers popping up. We can't see them all, but I can see that some of you are doing it, which is great. So the reason, first of all, why we're asking if you've ever done any of these is because these are all things which are illegal in the UK. And it's an exercise that we've taken from some training that we deliver to probation officers called normalisation and unconscious bias. And we do this particularly for people when they're working with young adults, so people aged 18 to 25. And it encourages people to reflect on when they might break the law, but they've perhaps normalised it, made it acceptable to themselves, think it's okay because it's maybe not doing anything too harmful. And it's really just to get people to think about some of the people that we work with. Some things might be normalized to them that actually are a lot more serious, but because of whatever's gone on in their life, maybe their childhood as an adult, people that they've kind of been brought up around, things that might seem quite extreme to us are actually quite normalized to them. And it's not to make those behaviors acceptable, but it's just to try and get professionals to put yourself in their perspective and actually understand a little bit more why they've got into the position that they have and some of the things that have led them to that. So yeah, hopefully you enjoyed that. And as I said, not going to be taken any further, so they might not even be illegal in your countries. Next slide, please. So what we're going to talk about now a little bit is some of the ways that we've been working in probation that differ slightly because of our involvement with the Violence Prevention Unit. So on the right hand side are some of the things that we've been involved with that we're just going to kind of give you a brief overview. So one thing that we've done for about getting on for kind of 9 months now is that we get weekly reviews from the police of anyone in Cardiff, which is the capital of city of Wales, who's arrested for violent or drug related offences between the ages of 18 to 25. And the reason we get that is because we're specifically focusing on working with young adults and trying to work with them in that preventative space, so that we're capturing anyone who's arrested potentially for kind of lower level common assault offences, drug possession or drug dealing offences, so that we can make sure that we're capturing them and doing appropriate work with them at that stage to try and prevent them from escalating to more serious offences. So in probation, for example, some of those risk assessments for some of those individuals might be quite low, and it might mean that they're not getting the spotlight on them that perhaps we'd want them to have. So we then engage with their probation officers, suggest some work that they could do with them on a one-to-one basis. It might be suggesting some forums that they could have multi-agency discussions of them in, and just making sure really that they're working with them in a way that's appropriate for their age range, so taking things into account such as maturity, family settings, that kind of thing.
Okay, yeah, and we've also engaged with the Cardiff Youth Justice Service. So obviously, I'm assuming it's the same probably everywhere. We have our criminal justice system means obviously you're pre or post 18. If you're pre 18, then you'll be managed in the YJS. Post 18, you'll be managed in probation or with HMBPS. Now, what we've identified in YJS, and I can say this because I was also seconded to the YJS for 2.5 years, they do some things really, really, really well. So they take a very child-centric approach. They think of the young person as a victim as well. They offer support around that and take a very holistic approach to managing that young person. Where in HMPPS, because of the numbers involved, because of their, I suppose, considered maturity, even though we do know now that maturity doesn't happen at 18, it's more likely to happen around the 24 and 25 age range, that actually we're very risk orientated in how we work with people. It's about managing the risk and then, I suppose, looking around the holistic issues around that. But what we identified, especially with some of the young people in Wales now, in Cardiff, some of the offences they commit in are very, very serious. They're, including murder, they're including use of weapons, they're very violent, they can be sexual. So actually your understanding or management of that risk has to evolve. So we attended some meetings to kind of give some feedback around that and to kind of share our risk management experience. But I'd also like to think that we took something back from the YJS in relation to the holistic approach they take to working with young people. For instance, they're extremely good at identifying that contextualized relationships around that young person, who they're associating with, who their friends are, that kind of thing. That led on to another piece of work, which Alice is going to mention.
Yeah, so on there, it was called the Serious Violence Multi-Agency Case Conference, but we thought it was a little bit too wordy, so we've changed its name to the Violence Prevention Case Conference. And this is essentially a multi-agency meeting, so it involves professionals from probation, the police, some of our third sector agencies, so charities, and the youth justice sector. And the purpose of those meetings is to kind of discuss those at-risk individuals who may not be current to statutory services, so they may not be under probation or the youth justice service, but they might be causing some concern through the police or concern through individuals that are associating with. So it's identifying, again, in that preventative space, whether there's any agencies that can work with them to try and stop them from kind of entering the criminal justice system. We also take a look at perhaps groups of individuals. So in Cardiff, for example, we've seen some issues around kind of gang related offending or groups of individuals who are offending together, and it's very much about discussing them as a whole, so that we're not looking at isolated individuals, we're looking perhaps more at the trends and patterns of groups in Cardiff who are causing serious harm. And this again has led to really useful intelligence sharing. It's allowed agencies to work together in a more coordinated way, and it's helped us really work with the third sector agencies, which is perhaps something that we haven't always done in probation. So those conferences are now held monthly, and they're kind of evolving really. We started off as quite an informal discussion, and we've had involvement now from more agencies who've seen the benefit of the way of this working.
Okay, so as well as that, which is a really interesting piece of work we're going, because as Alice said, the join up of YGS, so pre-18 and post-18 work is just, it's something that we talk about, and we have a seconded probation officer in the YGS, but often we were finding a lot of that intelligence information wasn't crossing back over, and this kind of meeting helps us get a better understanding of the risk for young people. So as Alice said, we specifically look at groups rather than individuals, which is different in other forums. So that leads then onto the Joint Intelligence Project. Now, this is a nationwide project in Wales. So it's been developed in Wales and then it's going to be rolled out in England. Now, in Wales, we've got counties, I believe, similar to your states. So we have the Joint Intelligence Project, there's 6 states, if you want, or 6 counties in Wales, North Wales, Dyfed-Powys, Gwent, Swansea, South Wales split into 3. So because of that, we've kind of, I suppose we're taking more of a localized view to the issues that are going on in those individual counties or states, so we can manage it better. In Cardiff, which we've mentioned before, there is a issue around serious organized crime, but there's also issues with a disorganized crime group. Now, our definition, if you want, of a disorganized crime group in Cardiff is a predominantly young street gangs, if you want, not that they have necessarily have all of the what's the word I'm looking for? links that you'd say to a street gang, as in we don't have colours over here, or it's not necessarily based on postcodes, but they're a loose affiliation of group that are more offending together for financial gain than anything else. Because of this, the Joint Intelligence Project, we have prison, probation and police, and we also have a third sector agency called Sidestep who work with young people to try and move them away from that lifestyle. And we attend a multi-agency meeting where we try and disrupt the serious organized crime or the criminality, be that in prison, the community, wherever it is, because I'm not sure what it's like there. But here, just because somebody locked up doesn't mean that the offending stops. They can still offend in prison, and it also means they can still have an effect in the community as well. I think drugs in prison are worth 6 times as much as they are in the community. I think that's the last thing. It is. Trust me like that. So yeah, so the Joint Intelligence Project enables the 3 organizations, so prison and probation, even though they're now together, they often can be quite separate. The JIP enables those 2 and the police to share intelligence and information better around these individuals to better manage them. We're also to work together to tackle that kind of and disrupt that kind of activity. Then through our engagement through Sidestep, we noticed that if there's, say, people in this organized crime group, or they're on the periphery, they don't really want to be involved, we can send them down the diversionary route while sending the really entrenched members to prison. We can also link in with Sidestep around those kind of siblings or cousins or younger people who might get dragged into that lifestyle. So yeah, beneficial.
Yeah, so the next area is upskilling of our staff. So again, in probation, we do some things really well. We've always focused on kind of people who've committed sexual offences, people who are on life licence. Domestic abuse is a strong focus that we've had. And I guess working with young people is kind of an area that we haven't always had such a strong focus on. So upskilling of staff has been really important so that they're aware of some of the current and developing threat areas, which particularly, as we're seeing, is related to things such as county lines, cuckooing, child exploitation, modern day slavery. So we've put together some toolkits that we send out to staff so that they have a better understanding of the risks involved with these people and then also how to work with them. We've also put together some information on something called threat to life warnings. So the police can issue threat to life warnings to individuals where there's an identified serious risk of harm to them. Typically, they've been used for domestic abuse victims, potentially where they've chosen to remain in a relationship with someone. But we're seeing it more and more where there's increasing rivalries in terms of kind of drug supply, county lines, as we said, gangs, that sort of thing. So we've put together some documents, and we're working a lot better now with the police around these threat to life warnings, so that as agencies we can work together in a much more joined up way to protect those individuals and make sure that, for example, if staff are seeing them, they're aware of the potential risks, so they're not seeing them maybe in public places or doing home visits at a time when they could also then become a risk from people that they're at risk from as well. And as we said at the beginning, we've also developed some training on unconscious bias and normalization, which is where the little exercise came from, which again is really focusing on working with young adults, because I think some of us can feel quite removed from that. We see a lot of, or we did pre-COVID, we saw a lot of kind of media interest around young people getting involved in fights, getting killed, and it's given a really negative view, I think, for some young people, and that can naturally kind of influence the way that we work with them. So it's making staff become aware potentially of their own biases and how that can influence their working and how they can then overcome that. So we've delivered that over the last year to all the newly qualified probation officers and then to some of our partner agencies as well.
Okay, yeah, and I think Alice has answered a lot of the 2 points I was going to mention below them as well, and they all kind of fit in sorry, together. But I think what's really important is that the public health approach that we mentioned at the start of our presentation, and also the violence prevention unit, because the violence prevention unit brings in multiple professionals. So it's not just law enforcement, it's not just probation, it's the third sector, it's public health professionals. So we get a wider view of the issue and a wider understanding of what causes these issues, because as everybody's aware, people aren't generally just violent. There's lots of reasons for that, economic, social reasons, the ACEs that they maybe suffered as a child, lots of different reasons. So for us to work together to kind of tackle these, we have to kind of engage. We can't do it in a silo. We have to work with other agencies. So our team, through working in the VPU, as Alice has said, has become kind of experts in relation to serious organised crime and serious group offending, and we get to develop and share that information and our knowledge with other offender managers. It's an area in Wales which is developing, as I suppose a lot of work around neuroscience in relation to younger people is developing, in relation to ACEs is developing, hidden harm, and we're just trying to put that in place for people. As Alice said, we kind of, through the work in the VPU, we developed a training around unconscious bias and normalization that all newly qualified officers now engage in, and that is to give them a better understanding while working with young people. Because what we'd identified is in Wales, 16% of our cohort was between 18 and 25, but they count for 25% of our serious further offences. So it shows that actually, even though they're quite, not the hugest number, they are having a big impact, even those cases who are being managed in the criminal justice system. So we need to work with them in a slightly different way so we can make more progress with them. If you change the slide, please.
So we just got a bit of a case study here that just kind of outlines, I guess, a really positive outcome for some of the work we were doing. So as we said earlier on, we started linking in with the Youth Justice Service, and they have case planning forums where they discuss high risk individuals. So we started attending those so that we could, as we said, give our input on risk, but also potentially link any adults that might be related to that young person. So a young person along with a friend was found at a property with older males who were found to be exploiting them and exposing them to a lifestyle of violence and drugs. So I went away and cross-referenced on HMPPS system the adults that were mentioned, and one of them was identified then as being supervised in the Birmingham area, which obviously is in England and kind of a completely different probation area to us. So contact was made with the local probation and police contacts in the Birmingham area, who confirmed that the adult at the property was involved in an organised crime group, but they weren't actually aware that their offending had kind of been brought into Wales. They weren't aware of that county line link, and they weren't aware of them exploiting younger people as part of their criminality. So they were then able to update their risk assessments and reflect that in kind of their risk management planning. The police were then able to put in opportunities for picking them up, for diverting them, for disrupting them. And essentially the whole aim of that was then to protect these younger people from this organised crime group. And I would kind of withdrew then, as the communication channels between all those organisations had been established, and they were able to share information around their risk. But prior to that involvement, the males who were operating down in Cardiff and exploiting these young people, it was very much an unknown in Birmingham that they were doing it. So again, it's about joining up some of the good work that's already done and making sure that people are aware of what's going on with the individuals that they're working with.
Yeah, I'd just like to, just there. I think serious organised crime groups or offending in general, they can be very fluid, very dynamic. They're very quick to respond, where arguably sometimes us in the criminal justice system or even in HM, we can be a little bit slower, and there's lots of gaps. So as we mentioned earlier on, YJS work up to people 18, then when they go over 18, they become HMPPS. If they offend in one area, it's not necessarily picked up by the police or social services in another area. So our ethos was just around filling in those gaps and producing a piece of work or a project where we could be fluid as well. And any of those kind of gaps that we saw, we could fill in then to make sure that those young people don't fall within those gaps. If we move on to the next slide, please, if that's okay. Okay, so this is outcomes, which I suppose is a very polite way of saying this is what we think we've done really well. Obviously, I think we have done things really well. There's still work to go in relation to this. As we know, having organizational change or changing an ethos or the way that people work is really difficult and can be a slow process. I mean, in relation to getting intelligence or information from the police, that can still be difficult, but they've really embraced with a dare to share ethos, and that's improving all the time. Sometimes it can be harder for us to get information from prison than it can from police, and we're supposed to be the same business. But again, this is improving over time, and people are understanding that you can't manage people in separate silos and that we have to work together. So, as we said, there's been an increased information sharing between agencies involved with young people linked to criminality. So there's not a block now, depending on their age, because we can share information really quickly, and we can share information intelligence between multiple agencies. Now, part of that has been set up through multi-agency sharing agreements, or they're called WASPs here, but I think this is to show that while things can be a little bit difficult in putting things like that in place, they're not impossible. If there's a desire to do it, there is a way around it. Now, there's also been increased diversion opportunities through referrals to third sector, and that includes if we're working with a father or an older brother, and we think that their sibling or that child is at risk, we can refer them in so they get that support at a much earlier stage, rather than arguably having to commit an offence themselves and becoming known to the criminal justice system. It also means that we can target that resource a little bit better, because we have more intelligence and information about those people who are fully entrenched at the moment, and maybe those who are being coerced or being groomed, or, you know, other people around it. As we said, there's been disruptions of individuals causing ongoing harm. So we've got lots of case studies and examples of where our actual input has had an impact and kept people either safe, managed their risk, has led to either recall back to prison, or maybe a move rather from open conditions into closed, and has enabled people to be safer, you know, be that in the community or in custody. So we've got examples of that, which I'm sure Alice could share to you if anybody wanted to see that outside of this. Again, we've improved staff's knowledge and understanding of working with young adults, and that's really important. I've been in probation for 13 years now, and I think we're a very progressive organisation, but we can, as I said, with any kind of civil service thing, it can be a little bit slower. You know, when I first came into probation, 18-year-olds had come over from the YJS, and they'd be very much treated in the same way as a 45-year-old would. And as we know, that can't be the case. We have to treat them in a slightly different way. They can be vulnerable. Their emotional intelligence maybe not up to that of an adult. So there's work to do. You know, they can express challenging behaviours, that kind of thing. So we have progressed as a service in working with that. And again, our engagement with kind of partnership agencies and things like the VPU is improving our knowledge of that all the time. Mapping of people and places to identify patterns of harm. So that's something that we're doing recently. So our police colleagues are very good at mapping, I would say, organised crime groups or offenders who are linked to other offenders. And as partner agencies, we're often, I think, verbally or individually, we'll know lots about an individual or a group, but it's never written down anywhere. So we're working on a piece where we're going to map that. So young people, the areas that are causing them issues, who's linked to who's got beef or who's in an argument with other people, we'll have that down so we can share that with partners. So that will help us when we're working with them, because currently in Wales we're in a lockdown, but when things are open up, obviously some professionals go to their home or see them in cafes and that kind of thing, but that might be putting them at risk. So this is a wider piece of work we're doing around that, which will help all different kinds of professionals. We have an impact on policies and process with regards to addressing youth violence. We're also engaging closely with people with lived experience. So when I talk about lived experience, I'm talking about ex-offenders, if you want, or ex-people who were previously committed kind of drugs offences, violence offences, and we speak to them about, well, what's their view on it? How do they think probation works with people? What would work better? What do they think that we need to put in place to help people move away from this kind of lifestyle? Because arguably people from these communities themselves, from these kind of who've been involved in this kind of lifestyle, have a better idea of what works than maybe some professionals like us. Also, as we said, we're very much keen on safeguarding, so adult safeguarding as well as safeguarding, and we just started to develop a lot more around the contextual safeguarding, because in probation, we were very good at identifying the risk within the familial home, but we weren't so much, so key, I think, or so obviously looking at the risk in relation to their associates or their friends outside of that, and that's something that we're kind of working on. So Alice, anything to add on any of the outcomes? Yeah, so on to the next slide, but the next slide is just going to be a breakdown of emails of where you can contact us on. But I suppose our bit now is to open up for any questions. Only nice questions, though, please.
One person mentioned in the Q&A that it might be useful for any American attendees if you explained what county lines are, maybe cuckooing.
Ah, okay.
Yeah, sorry. So county lines essentially is where drug groups, organised crime groups look to move their drugs into more rural areas, say where perhaps there isn't the influx of drug dealers, for example, and they'll create a line, say from London to, I don't know, Hereford maybe, which is in Wales, and they kind of do that in a way to obviously distribute more, and they'll utilise young people often, so they'll put them on a train, get them to take the drugs to the rural area, they'll then sell their drugs, and then they'll bring the income back.
Yeah, no, I think just to give for hopefully for our American colleagues, I suppose it'd be like drug dealers from say LA or New York or more of the entrenched urban centers going to the smaller towns or smaller cities where drugs maybe is not a big issue, and then they start selling their drugs there. So that can bring with it a level of violence that maybe that area hadn't seen before. It can bring an increase of drugs, including the, I suppose, how well, the purity of them and things like that.
And one of the biggest things that we're seeing with that is the exploitation of young people. So rather than themselves kind of getting involved in these county lines, they'll organise it, but they're targeting young, vulnerable people to carry out the work for them. So then if they get stopped by the police, they can just move on and they can find someone else to do it for them. So it's causing a lot of issues, obviously, for the communities that they're coming into, but also the people that they're involving it with. And then cuckooing is essentially where, again, drug dealers groups will target a vulnerable person's house. It might be that person themselves is a drug user and they're vulnerable because of their circumstances. They'll go into that home, they'll maybe say, we'll give you free drugs if you let us use your property, and then they'll essentially take over that address. They'll use it to stay in, they might use it for things like prostitution, they'll use it to kind of cut drugs, sell drugs from, and essentially that vulnerable person then has had their home taken over. The police may then raid it and they can become involved and they can essentially be arrested, and obviously it will massively kind of impact their lifestyle, their way of living, and it can have a really negative impact on people.
Yeah, I think so. Cuckooing county lines are usually very exploitative, as Alice said. They take advantage of vulnerable people or young people. Also, what we're finding with some young people is they're kind of groomed into this lifestyle, so they might not necessarily even know that they've been exploited, but they often have. There can be use of debt bondage as well, which is basically they'll give drugs to somebody, they'll leave with them, then they'll have some other people rob them of the drugs, and that person comes back to them and go, I've had the drugs stolen. So all of a sudden they're in debt for those drugs that were stolen, and the same gang has actually stolen them. So it's a very exploitative way of working, and it is something that we've noticed a lot in the UK, where, as Alice said. So as well with the cuckoo line, what will happen is the drug purchasers, say maybe in in Newport, for instance, they will phone this telephone number, and this telephone number would be held by the drug dealer or the principal OCG member in a different city, who will then text a young person back in Newport and ask that person to drop off the drugs. And that way they can keep an eye on what drugs are being sold, how much money needs to be taken, and everything like that. But they're never, ever caught with the drugs themselves. So it's quite, I suppose, safe from their point of view in relation to being caught.
And one thing I will say is that criminal justice agencies obviously are becoming more aware of this, and there is something in place called the National Referral Mechanism, and it can be used for people who are identified as kind of victims of modern day slavery, and under that would come potentially someone who's been exploited into running a county line, or whose address has been cuckooed if they're arrested. There are kind of measures that can be put in place to get these people support. And then, for example, as we said, if they've been arrested, looking at a potential defence for them, that they've actually been forced into this, and whether that's kind of through emotional, physical abuse, so that they're not just dealt with as a perpetrator, they are dealt with as a victim as well.
Great, thank you for that explanation. That will be helpful for Americans involved. We also have another question from Francesca Menicelli. I apologize if I pronounced your name wrong, who also gave the suggestion about county lines explanations. She asked, were CRCs involved in this work at all? If so, were there any problems in working alongside them?
So for our colleagues not in the UK, CRCs are community rehabilitation companies. So several years ago, Probation actually split. They became partly privatised, which is community rehabilitation companies, and partly public, which is the National Probation Service. In Wales, we actually have joined back together now, so we're all one service, but in England, they haven't joined back together yet. They are going to be doing that in the next year. So in Wales, there hasn't been an issue with that because we are now one service again. But I think typically what we've noticed is that people convicted of drug dealing offences are identified as lower risk, and as such, they are held by the community rehabilitation companies. So historically, that has brought some issues in terms of kind of looking at available interventions or risk management options. But here in Wales, it's not so much of an issue because, as I said, we're one service, so we can move service users around between kind of probation officers quite freely. But in England, there's a whole process that you have to undertake if you want to move someone from a lower risk group in the community rehabilitation company to the National Probation Service where they're higher risk. So it may be an issue, but hopefully once in England the services are brought together again, it might resolve some of those concerns.
Yeah, the only other thing I would add to that, I worked in London when the CRC and the MPS was there, and we were part of a gangs team, which is similar to what we're doing now, and the CRC was part of that. And actually what they were able to do, because I didn't have some of the issues that we have in the public sector, they were able to be more think outside the box a little bit more. So actually they employed some people with that lived experience, and they were really good. So I think there's great potential both in the CRC at the moment until it becomes back to the MPS. But yeah, there was no issues.
Great, thank you. That was our last question in the Q&A. Participants can also raise their hand if they would like to ask their own question aloud, or put any remaining questions for James and Alice in the chat or the Q&A.
And just to add, if you have got any questions, we're happy to, well, when you can, fly out to wherever you are, or even probably go to England, as long as you're on the coast or somewhere nice, then we're more than happy to come along to have a chat.
We can't actually see. Are there any other questions?
There is one, and I believe I can, if you would like to ask it aloud, Francesca, I think is that I can allow you to talk, which I will do right now.
Can you hear me?
Yeah. We can.
Oh, hello. Oh, excellent. Thank you very much. Yeah, so thanks very much for this presentation. It was really, really interesting. And if you could expand on two things, because I thought it would, particularly the Welsh side of things was always really, really interesting and doesn't get heard or talked about very often. And if you could expand on the involvement of people with lived experience, and also your work with the prison system, because I've done research on this in England, and it's always a bit problematic in the sense that prison doesn't really talk to probation, and they release offenders and no one knows about that. And then, oops, you've got an offender with a history of, violent crimes or drug dealing, and they're released at 7 p.m. and no one knows where they're going to spend the night. So if you could just talk about how you guys deal with these issues on the border, that would be great.
Okay, I'll answer the prison one, I think, and then I'll hand over to Alice then. So in the prison one, I'm not agree with everything that you just said. As 12 years as a PO, I would agree with all of that, and it's certainly not perfect in Wales. However, we have a service integration manager here in Wales, so that is, I suppose, their specific role is to make sure that the join up between prison and probation is a lot better. Now, I'm not telling you that that's perfect as well, because there's different systems, and people are very slow to change their kind of way of working. However, there is the potential and there is the understanding that this needs to happen. Through the Joint Intelligence Project, for instance, we have buy-in from the security governors and then the analysts themselves who feed in and present to those meetings. But it's very much, I think people want to see, well, if I'm going to engage with this, if I'm going to spend a lot of time and effort on it, what am I going to get in return as well? And that's what I suppose our multi-agency work is able to show, is that actually we have an impact in relation to contraband going in the prison, managing of risky individuals within prison, and also we're very keen on making sure that they have to understand that when it comes to risk management, it's not just risk management of cases within their four walls. Prison also have a responsibility of managing their risk when they come out into the community as well. But I would reiterate, it's an ongoing process. It's not in Wales, while I say it's good, it's not perfect. And we're probably aided by the fact that we have less prisons in our country. I'm not saying that everybody knows everybody in Wales, but it is a little bit of a smaller environment in relation to senior leaders and that kind of thing. So it does help, I think, around case discussions, risk management, intelligence sharing. Alice, have you got anything you wanted to add on that?
Yeah, we've also got, I'm not sure if you're aware of, it's called OMIC, so it's offender management in custody, and that's fully been brought into place in Wales now, and again England are bringing that in. So essentially we've put a lot more probation officers into the prison. So we're split now, we're called prison offender managers and community offender managers, and for those higher risk individuals in prison, they'll all be allocated a prison offender manager who is a probation officer. So it allows for a lot better kind of working in the sense of release planning, sentence planning. There'll be a handover, so from about 8 months prior to release, the prison offender manager will hand over to a community offender manager, but they'll still remain involved up until that release period. So that does help a little bit in terms of kind of making sure that they've got accommodation or an approved premises placement if they need it, that they're speaking about license conditions and that sort of thing. But again, that's for the higher risk individuals. So if they are lower risk, they will just have kind of a generic prison offender supervisor who perhaps, I don't understand necessarily how prison offender supervisors work as well as they probably don't understand how probation officers work as well. So there is still that join up to do, but OMIC, as it's called, has definitely kind of improved that relationship of putting probation officers into the prisons.
And the second question will be answered there. What was the second question again, please? Sorry.
It was about the use of the reliance on people with lived experience. So and how you work with them.
Yeah, so again, this is kind of quite a new thing. Again, probation in Wales are looking to do this more. We've kind of, at the beginning of our work pre-COVID, again, we were linking in a lot more with the prison, and we were speaking to individuals who are in custody now for offences linked to drug supply, county lines, as we said, just to kind of understand from their perspective what's gone on, what has helped or what hasn't helped. And again, more recently, we've linked in with 2 service users who have both been to prison themselves. Both, I think one was one's been through rehabilitation in terms of his drug use, and one of them was quite a prolific drug dealer. They've both now turned their lives around and work for a charity to work with people who are still in the prison system. And we've been linking in with them again, just to kind of have conversations around what worked for you. And for them, it was very much having someone that they can speak to that perhaps wasn't as authoritative as, say, a probation officer or a police officer, but someone who's a bit more relatable to them. And they often found that if it's someone who has been through their experiences, they find it a lot easier to kind of open up to that person, and they've got a better understanding of it. So it's a really difficult thing, though, because obviously we have to be confident that that person is on their journey of desistance and they have moved away from a lifestyle of crime, and we don't want to be bringing in individuals who potentially could draw them back into criminality. So it's quite a difficult one, and it's one that is still a very emerging thing, I think, in Wales. It's not something that we've kind of got to completely yet. It's much of an exploring thing, but so far we've had some really positive outcomes with the individuals that we have been speaking to.
Yeah, at the moment we're very much focused on them upskilling staff and giving us ideas, because like I said, you know, it's not easy, but we can go up to somebody who's been involved with drugs all their life and tell them what we think to do. But then what we're finding is a benefit is to speak to these people who've actually gone through that journey themselves, and the language that we're using, is that appropriate? Is the idea, this is what we're trying to do with this help? Have they got any other ideas for that? So then we can go back to the people who are coming up with the kind of policies and the process and say, well, this is what we've got from people with lived experience who are saying, does it marry up? Is there something they can consider? That kind of thing as well. So yeah, it's early days, as Alice said, but it's something that and I know Alice is, that we're benefiting a lot from speaking to these people with that kind of lived experience.
Excellent. Thanks a lot, guys.
No worries. Hopefully it answers your question.
Yeah, absolutely.
Any more questions?
If not, then I think if everyone's happy, we'll let people get their nights back if they're in the UK, and go for their lunch if they're over in America. Yeah, so thanks. So is it just going to say bye from Alice and myself?
Yeah, and as I said, we put the email address up, so if you've got any questions or you want to see a little bit more about the Wales Violence Prevention Unit, we've put the website up as well. Thanks all.
Thanks all. Cheers. Thanks Alyssa for helping out. Cheers.
Bye.
You're welcome. Bye, everyone.